infection prevention and control. Please wash your hands. Infection.
Principles of integration. You have to know these principles. You have to build an existing opportunity for integration. You have to involve other stakeholders. You have to recognize the services, and you have to orient the community to create demand for the services. Those are just principles of integration. Now, what are the factors that can promote integration of sexual reproductive health services? What are those factors that can promote integration? Yes, you could be somewhere you want to integrate, but you cannot integrate. What are those factors that are going to promote you to integrate the services? One of them is training. This is why I'm training you people to be able to integrate services, to learn. We are going to go through the advantages of integration, disadvantages. At least you learn that integration is very, very important as of today. So training is a factor. Then improving infrastructure. Yes, you might want the different services where to refer a client to. So you must have infrastructure on where to refer the clients. HIV clinic, there is infrastructure, you have it. Counseling and testing is there. Counseling clinic is there. Adolescent health friendly service clinic is there. At least there is infrastructure. So that helps you to promote integration. So we are also looking at sustainability. For you to sustain your clients, you have to integrate services. If a client comes with, like the other mother A, client A, she came with the headache, we said, maybe fever and diarrhea, and then if you just treat the diarrhea, she goes home. Probably after 1 week, 1 month, 2 months, she'll come back with the same problem, because probably she could be having HIV and she's getting into her tertiary stage of HIV, and you have not really found out whether she has the HIV. So if you integrate, at least you are helping availability and sustainability of resources. The other factor is effective referral system across the services. If there is a referral system, it really helps to promote or integrate reproductive health services. Constant and timely integration supervision. If there are supervisors that will supervise you and you're supposed to integrate services, of course you will have to, because you are supervised. Community sensitization is also very important. Okay, any questions so far? Are you still comfortable? Let's look at advantages of integrating reproductive health services. Advantages of integrating reproductive health services. To the client, it upholds the rights of the client to information, confidentiality, and continuity. It upholds the rights of the client to information, because you'll be giving them information as you're counseling them, as you are health educating them. They always get to know many issues. They'll get to have knowledge on many conditions. Confidentiality, of course, you have to be trusted enough to keep patients' confidentiality. That is our ethic, you know that. Patients, when they are integrating reproductive health services, they get to be comfortable. For example, look at that mother W. She had the signs and symptoms, thinking she has malaria. She wanted treatment only and investigation, and she goes back home. But when she goes back home, knowing her SR.T status, whether positive or not, she's going to get comfortable and she will have continuity of services. So that is an advantage of integration. Secondly, it saves time and it's very convenient. It addresses all clients' reproductive health needs. It helps the clients to identify reproductive health risks such that they are able to put a stop on maybe their lifestyles, since they don't want to contract infections and all that. It improves access to the client's health services and improves client-provider relations. When you counsel me very well, when you talk to me very well, I'm able to be your friend, because you have created good relationship between me, the client, and you, the service provider. So it helps to improve client-provider relations. So I'm even able to tell you all that it suits me to tell you. I can be able to share freely because the relationship is good. People, I don't mean the other relationships of love and the intimacy, but I mean that relationship of omusawo with the client. So we are looking at advantages of integration still. Integration increases client satisfaction. They say, okay, yes, I went to this hospital and yes, I'm very comfortable. I have got all the services. I'm even negative now. I can stop now the multiple section network that I was having. Then I'm able now to settle because I've been cancelled, and it is cost effective because many services are obtained on one visit. As we normally say, it's a one-stop shop where you find all the services that you need such that you can keep your reproductive system healthy, mentally, physically, and socially. It leads to improved service delivery outcomes. Yes. Another advantage is women with unmet need for family planning can be able to access the services because there are always family planning methods available, so you can access services. The other mother W came with thinking she has malaria. She can even as well go with the family planning method and she's able to plan for her family. Yes, that is an advantage of integration. It reduces mother-to-child transmission of HIV because like when they are cancelled and they are tested and they are given post-test results, they are able to start them on ARVs in case they are positive. So they are able to live positively and they are taught about health promotion and they take their ARVs very well. Yes, integration improves access. Whenever they find a problem, they always want to access the unit or the center where they access the other services. Then it provides quality. Since you are always supervised, you health workers, on how you integrate your services, it aids to provide quality care to the clients. Quality means a lot. Patient is going to receive services and good services in a very short time possible. Okay? They receive them timely. Their environment is very clean. Quality has many components, but shall look at those when we come to quality care as a sub-cost unit. We said it improves access. People can be able to access services as they need them because they were trained, they were cancelled, they were given information. Yeah, they have the knowledge, so they have to access services. More so, it provides quality and efficiency of care. People are able to provide quality care. They get good care that is that they really feel they should have, but in the shortest time possible. We shall look at quality. Quality has its components. The environment has to be clean. The turnaround time has to be very, very, very short. Stewardship should be good and it should be efficient. It should be very effective. Very effective. You don't have to discriminate. You have to use all that is available at the time you are giving a service. So all that is quality. I'm saying integration provides quality and efficiency of care. It can also reduce stigma. People who are fearing health service providers, since they interacted and now have good nurse-patient relationship, client relationship, nurse-client relationship, they are able to, to reduce their stigma they have about the diseases because they were educated. Lastly, it prevents unwanted pregnancies, unintended pregnancies, and it reduces sexual transmitted infections. I think I said that already. Advantages to the provider: it enhances competences in the health worker. By this I mean the health worker is meant to be knowledgeable and should have all the skills necessary to provide services. For example, if one is put in a family planning clinic, they are able to provide the service. If one comes, they need IUD insertion, the person can be able to insert IUD. If they want an implant, they can be able to get an implant. There is competence in the health worker. Still, Integration advantages to the health worker. It makes resources accessible to every provider. It increases clients' confidence in the provider. There is proper distribution of duties better because it makes sharing them more efficient. If one knows they are supposed to be in the adolescent sexual, in the adolescent friendly reproductive service clinic, they are meant to be there. If one is supposed to go for family planning, they should be stationed there. If one provides immunization, yes. If one is counseling, a counselor, if one is providing ARV, so you're seeing that it makes proper distribution of services and duties better. There's adequate number of human resource available, because if you need to integrate services, therefore you must have the human resource that are supposed to provide the services. That is an advantage, because you want to integrate, people get jobs because they have to integrate services. The other advantage is they are trained. They are trained on what to integrate. Therefore, they get the knowledge and skills. It encourages research and it helps achievement of gender equality.